what psychological concepts, what mental capacities could be behind these set of beliefs or mindsets that helped these warriors fend off PTSD in those that did. And cognitive flexibility was one of those. And so cognitive flexibility is not multitasking or task switching. It probably does happen in the prefrontal cortex, but it's underlied by the capacity to reframing negative events as potentially positive, although that's hard and a little bit Pollyanna, but as growth events, as opportunities for growth. And so let's say in an fMRI, I show you pictures of mutilation or war or the outcomes of some violent act or a gun or something like that. The amygdala and other regions that are involved in stress and pain and disgust would activate, right? But if I then asked you, say something different about that picture, maybe it was a woman crying on the steps of a church. Oh, it's not that she just lost someone and is leaving a funeral, but she just got married,
right.
Or she's at a wedding and is crying for the bride, tears of joy. And so almost anything can be reframed to some extent. Can you ever reframe anything from like purely negative, terrible thing to a positive? No, but can you reframe it to be something that is the way of the world or that is an opportunity to leverage and grow from? Probably. Having that flexibility, the ability to do that, can literally change the brain's response to the same picture. Or in another body of work using real-time fMRI, which I'll explain, DeCharms and colleagues actually looked at the pain response in the brain, the anterior cingulate activation, and showed participants in real time a picture of a fire, a flame, that would increase and decrease in concert with activation or blood flow to the anterior cingulate. And so they would have real-time feedback from their brain wired up to the MRI while they're in there managing pain. I think it was a heat stimulus to the arm. And so as the heat stimulus would change or would be there and linger, they had to either let it, just experience it, or reframe it. And they were given like 3 or 4 different ways to reframe it. And so when they reframed it, just changing their view of it, it's not so bad. I feel that it's less intense. And just saying things mentally actually allowed them to change the activity in real time in their anterior cingulate, their brain's pain response. And doing that in a control group showed that was possible. Doing that in a chronic pain group actually showed that there was dividends of being able to do that in an MRI unit using these reappraisal, reframing skills outside the experiment. For months, they followed them, and chronic pain for chronic low back pain was less.
That's interesting. I mean, a big thing that PTSD patients deal with is survivor's guilt, right? And so PTSD isn't necessarily a diagnosis that's made at the time of the trauma, right? There's got to be at least 6 months that elapses before you can make a diagnosis. Or I'm sorry, 1 month that elapses before you can make a diagnosis. So certainly, seems like that 4 weeks after the trauma is sort of this critical time window as to what is your relationship to that trauma going to be, and how it ends up being will determine how long do people suffer with PTSD, right? For years, this is what your life is going to be like. And you have this critical time window of 4 weeks to figure out how it's going to go. And the implications of that diagnosis, if you look at, again, we mentioned all-cause mortality, dementia, they're huge, right?
Exactly. The question really is not how long an adjustment period or an acute stress reaction can last before it becomes, diagnosable as PTSD. Who cares about that?
But what we care about is we're providing a framework. We're providing some sort of timeline to be able to understand how cognitive flexibility and changing our perspective on an event, how that ends up leading to either it being protective or potentially deleterious.
Right. My concern, though, is let's say this was an ankle injury and not a trauma to the mind or brain.
Yeah.
But similarly, an acute event that changed the course of the body's experience and the ability to function. And so if you let it linger for a month, not addressing the actual root cause of the pain or of the tissue damage, and not doing any repair work, rehabilitation, that ankle is going to be worse off. There's no question about it. So no matter what window we're talking about, a month or 2 months or a week of experiencing trauma unaddressed, could have repercussions for years down the line. And so I think the point that you're making is really valuable, and it's kind of like a hot topic in movies, in social media, but also in medicine. How can you get into the brain after a trauma in an acute window, minutes, hours, and change the brain's memory of the trauma or experience of the trauma or framing of the trauma so that the adjustment period is protective?
A healthy one.
A healthy one. I mean, there's a recent TV series where they had like implants in the amygdala, and it was aimed at deleting old memories of trauma. But those individuals had these kind of like missing pieces of their lives that otherwise would have enriched their lives with meaning and detail that they were missing. And that itself was not acceptable to them. Their brain and their body and their experience was rejecting not having access to that memory. Nevertheless, they did not have PTSD. And so you always have to go kind of back and forth on the line. Should you eliminate trauma from our lives, stress from our lives, or have some amount that we have the capability of managing so that we can have growth?
Right. And actually, this happens naturally sometimes in patients that develop PTSD versus patients that don't, right? So patient Humvee full of military personnel gets blown up by an IED. Some lose consciousness, some don't. As part of their IED explosion, those that lose consciousness, potentially that could be a protective factor against the development of PTSD, versus those that retain consciousness in the explosion might be at increased risk for PTSD. What do you think?
Well, so it's interesting that you say that, and I'm going to quote a study, and we're going to have to go look if I'm right on this or not. But I believe from Brain Sport, there was work where they traumatized rats while they're anesthetized, so shouldn't have any recollection of that, and while they're not. And they both have chronic consequences that look a lot like post-traumatic stress manifestations.
That's interesting.
And so it's not clear that a loss of consciousness would protect an individual from chronic effects of
But there's
trauma.
been those findings retrospectively in some studies.
Anecdotally, you mean like that if you lost consciousness, you didn't have the...
I
don't know.
It's
an interesting point.
Post-traumatic stress disorder. Yeah, I came across a retrospective study like that, which
Cool.
was interesting.
Yeah.
But like, it's retrospective. There's a lot of confounding factors, so on and so forth. But it's interesting when you talk about, if you just deleting an event, if that'll help you with your post-traumatic stress disorder.
That was the hope of propranolol, actually.
What do you mean, deleting?
Giving propranolol acutely after trauma.
So propranolol
was thought to block
propranolol is a beta blocker, right?
Right.
Beta 2 blocker that can decrease your heart rate and decrease your sympathetic nervous system activity.
But it also has central nervous system effects, and it was thought to decrease the brain's ability to take something from short-term memory and translate it into long-term memory. And so it was thought that acutely giving propranolol after trauma might decrease the capacity for that traumatic event to enter long-term memory and then haunt an individual long-term in the ways that trauma can manifest.
Yeah.
And so, I think Dr. Vanderkolk will talk about that. He writes about it in his book. I've actually heard about it, in the circles when I was getting my PhD. And it was coming about. But at the end of the day, I don't think that works. And we'll have to see if other biochemical or other kind of therapeutic means can actually change the acute event so that it never enters a long-term
Memory
negative.
consolidation, yeah.
Right.
Yeah.